All right, let's get started. Hello, my name is Hannah Harder, and I work for Kaufman and Associates. I would like to welcome everyone to today's webinar entitled "Menominee Indian Tribe of Wisconsin's Model of Long-Term Care." Today, our speaker is Denise Pommer. Ms. Pommer serves the Menominee Indian Tribe of Wisconsin as the Director of the Department of Aging and Long-Term Care. Employed with the tribe since 2008, Ms. Pommer was hired to oversee the Menominee County Reservation Aging Unit, providing programs and services supported with tribal funds, Title VI, Title III, and other grant funding. Over the past several years, Ms. Pommer has led the development of the Menominee model of long-term care, serving frail elders and persons with disabilities that are Medicaid, home, and community-based waiver participants. Ms. Pommer is currently serving the second term as an elected chairperson of the Wisconsin Tribal Aging Unit Association, and she actively participates in a long-term care study work group comprised of members of other Wisconsin tribes along with state officials. In addition, Ms. Pommer was recently notified of her selection as a recipient of the Greater Wisconsin Agency on Aging Resources and the 2014 Elder Ace Award. She is an enrolled member of the Stockbridge Munsee Band of Mohican Indians and is a direct descendant of the Menominee Indian tribe. Welcome, Ms. Pommer. We are also joined by Dennis Zach, who is a tribal case manager for the Menominee Long-Term Care Program. Welcome, Mr. Zach. On today's webinar, you will learn about needs assessments, the importance of tribal waiver programming, and how to identify stakeholders. You will also learn about the Menominee long-term care model, as well as their waiver program goals. I will now turn it over to Ms. Pommer.
Thank you, Hannah, and good afternoon, everybody. We'll get started with our first slide here, and I'm going to share a little bit about Menominee, the Menominee tribe at a glance. Menominee Reservation encompasses Menominee County and a portion of Shawano County in the state of Wisconsin. Mostly heavily forested lands here, so we're very rural. Our reservation consists of 235,000 acres. Our U.S., according to the census population, was 4,232, of which 87.5% of the entire county population is recorded as American Indian. So the reservation and the county here are largely coterminous, and as you can see, the high population is Native Americans. Median household income recorded at $37,644. A high percentage of persons live below the poverty level, and our unemployment rate is at 15.3%. According to the 2013 Wisconsin Health Rankings, Menominee County ranked 72 out of the 72 counties in the state. And that includes in our health outcomes, health factors, health behaviors, social and economic factors. The majority of the people that we're serving through our tribal aging program have annual incomes of under $10,000 a year. So it's a pretty depressed economy here. The length of life, or the potential years of life lost, and I think this is significant because potential years of life lost are deaths that are preventable deaths. The 63% higher in Menominee County than in the state, and 66% higher than the national benchmark. So among the 72 counties in the state of Wisconsin, Menominee is unquestionably the one county that has the greatest and most immediate needs. Why are tribal waivers important to us? Well, I think our tribe is, like many other tribes, experienced an early onset of chronic conditions, and our life expectancy is heavily dependent upon care. Tribal waivers support our tribe's self-determination, strengthens our tribal sovereignty, and I don't think it would be in disagreement to say that there is no greater cultural competency than the tribe caring for its own members. The tribal waiver program, in addition, adds an added choice for tribal members, particularly for our tribal elders, who are often reluctant to seek services from outside providers. And it keeps our tribal people in our own community and out of costly institutions. Just to highlight the history of the Menominee Waiver Program, prior to 2006, the tribe operated a group home that was not licensed by the state. It was fully funded by the tribe with resident contributions. In 2006, that group home was licensed as the Wolf River Community-Based Residential Facility. And in 2007, the tribe had an agreement with the county and the Wisconsin Department of Health and Family Services that enabled the tribe to receive waiver funding for eligible residents of the CBRF. In January 2008, the Menominee tribe, through the Department of Aging, was actually approved by DHFS as a waiver agency. And at the same time, the tribe was working to secure a 100% federal Medicaid assistance percentage. In November, FMAP funding was approved, and the tribe began to think about serving community members other than those who were just living here in the CBRF. One of the key points in Menominee's progress was the tribe and the county worked together to form a human services planning committee. And then in 2010, we assumed responsibility for all of the county's tribal waiver participants who were over the age of 55 and moved them into our tribal waiver program. We took about a year to make that operation, or actually less than a year, but to make sure that we had everything running as smoothly as we possibly could. And in 2011, the tribe had to amend their ordinance, which allowed the aging division or aging department to assume to provide services for people under the age of 55. So by August of 2011, we assumed all of the individuals who were Indian Health Service eligible from the county's waiver program, transferred them into the tribe's program, and that included persons with physical and developmental disabilities. In November of 2012, one of the key elements in this is to educate your state. And so in a number of different meetings with the state of Wisconsin, we've provided them with information on the 100% FMAP, and in November of 2012, we actually had a meeting here with the state to discuss expanding our program even further than we were. Some of our key goals are, one, to improve our health and morality statistics, narrow the gap for the critical risk areas that our people experience here in Menominee, certainly to maintain a cultural competent and sensitive delivery system, strengthen the Menominee economic base, and we're looking at expanding, what other options are there available to us? And just the example here would be the personal care agency. Another key goal of the program is to promote job creation and, of course, to strengthen tribal sovereignty and our self-determination. The Menominee model of long-term care was first conceptualized in 2012 at that meeting with the state. And the concept of our program is this is a community that's caring for its own people rather than an agency providing care. Important is the coordination and integration of long-term care services to the reservation and tribe as we expand our role in long-term care. Tribal income maintenance currently does our financial screens here. We utilize the ADRC specialist who does the functional screens. The Medicaid waiver program requires that an individual to be eligible has to be both functionally and financially eligible. So we're doing as much of this work as we can within our own tribe, We've currently applied to the state, and we will be hiring an aging and disability resource specialist who will be employed by the tribe and who also will be able to serve to provide the functional screens to determine eligibility for our program. We've hired a tribal case manager, and that's Dennis, who's here with me. And we have a long-term care administrative coordinator who will not only, do the administrative functions, but she also will provide case management. Probably about 25% of her time will be in case managing. We're currently in the process of really building our program where in the state of Wisconsin, the state is, much of the state is in family care. And so we're working to build our program up prior to family care rolling into our county. And so the next slide is assessing the need. And I'm in this slide, I really want to encourage any Title VI directors out there. If you don't utilize the universities for the identifying our needs, the survey of elders, I would strongly encourage you to do that. The measure of need for long-term care is evidenced by knowing the functional limitations of your individuals. And so the ADLs and the IADLs serve to create that measure of need. And within that assessment tool that Title VI provides, it does focus in part on the functional limitations, in terms of an individual's ability to bathe themselves, dress, walk, toilet, meal preparation, shopping, all of those things that go into the activities of daily living and those instrumental activities of daily living. The results that we found in Menominee relative to long-term care was that 54% of our persons who surveyed have little or no need for long-term care services. 28.3% had a moderate need, 3.3% moderately severe need, and 14.1% of our elders surveyed have a severe need for long-term care services. So utilizing those survey results, tells you exactly where you're at, but then it's also useful for your future planning purposes. Identifying the stakeholders, we have on here, first of all, is tribal leadership, and that's important buy-in. Educating your state Department of Health Services is critical. I have to credit the state of Wisconsin. They're very much committed to helping the tribes in this state to build our long-term care programs, and for that, you can't ask for anything more from them. Stakeholders include tribal departments. When we had the meeting in November of 2012 with the state of Wisconsin, what I did is I went to the Medicaid manual and I looked at all of the allowable billable services that were being provided throughout our tribe, and called to the table each of those tribal directors and said, you've been identified as a program that provides services that we might be able to bill for. For example, our housing department is building ramps for individuals, and some of those individuals are Medicaid waiver clients. Well, if the housing is building the ramps that are billable through the Medicaid program, and we can share that information with them and build the ramps through Medicaid, that allows housing to utilize their dollars to build a ramp or provide a service to someone else, and be able to stretch their dollars in that way. The county agency certainly has been a good partner in this. The Menominee tribe has a local college, the College of Menominee Nation. College of Menominee Nation provides classes for home health aides and certified nursing assistants. And then another stakeholder that we identified, of course, was our Aging and Disability Resource Center. Of significance in the Menominee model of long-term care are the expanded roles for our tribal agencies and tribal members in service delivery. There are economic development opportunities for tribal members, for businesses that exist or may be developed, and tribal agencies. Some of the examples of services for tribal members or agencies are the supportive home care program, home improvement assistance, housing counseling, supported employment, and other. Those are all services that's allowable through the Medicaid program. The number of eligible waiver participants currently being served from when we first transferred individuals in 2010, there were 32 people who were receiving services. And to date, this slide is actually off by one. We're serving 96 individuals today, and we have an additional 24 who will be served in the very near future. Now, when you think back to the statistics of Menominee and how very early, how very young we're dying here, this program is absolutely critical for us to be able to provide those critically needed services to people at an early age. And again, you know, the potential years of life lost being preventable deaths, this is an opportunity that, you know, is very, very significant for us here in Menominee. I believe that's the end of the slides. I know that went kind of fast, so I hope we have a lot of questions. You know, I could expand a little bit more on perhaps our ability, how we're able to do this. The tribe receives 100% federal Medicaid assistance percentage. In addition to that, we do receive 7% administrative fee on all the cost of services. So to date, we've been able to provide this program, you know, at no cost to the tribe. But Hannah, I think we could probably open it up for questions.
Okay, great. Well, I'd like to thank you so much for being our speaker today. You did a fantastic job. And we are now going to begin our question and answer session. If you would like to ask a question, please press *6 on your telephone keypad to unmute your line, and then you can ask your question. Or if you would prefer, you can also type your question into the chat box, which is located in the lower right-hand corner of your screen. Again, that's press *6 to unmute your line to ask a question, or type your question into the chat box. It looks like we have a few people utilizing the chat options, so we'll give them a few seconds to get their questions typed out. But in the meantime, do we have any questions on the line? All right, we have a few questions in the chat box. The first one from Sandy Bird. How do you develop the opportunity to arrive at 100% Medicaid?
Okay, I believe that is possible through the your federal qualified health centers, and the 638 contracts with Indian Health Service. There's language in the health centers contract, and so that's where you would want to put in, first of all, that you are providing the long-term care services. 100% FMAP is actually, let me find my reference sheet here. Let's see. I believe in the Social Security Act, Title 19, Medicaid states that the federal medical assistance percentage shall be 100% per annum with respect to amounts expended by states as medical assistance for services that are received through an Indian Health Service facility. So the authority then comes through the Social Security Act. And I believe here in 1996, CMS extended the 100% FMAP to states for services provided by tribal facilities administered under the Tribal Self-Determination Authorities. Next question.
Great. So the next question by Maggie Simons, she asks, will the slides be available? And I can answer that question. Yes, the presentation will be available, and I will provide those instructions at the end of the question and answer time. They will be available on the cms.gov website. The next question is, do you serve non-tribal members such as spouses? If yes, how is the reimbursement determined?
Okay, presently we do not serve non-tribal members. However, we have been speaking with the state of Wisconsin, and the 11 tribes in the state have had conversations with the Department of Health Services, and a concept paper is being prepared which would allow for a tribal-only waiver program, if you would. As the state of Wisconsin, for example, moves into family care and IRIS, it's our belief that this tribal waiver under federal authority would allow our tribal people an added choice in their long-term care provision, service provision. I believe in that concept paper that we're proposing that we would serve non-tribal people who are residing in the same household as an enrolled tribal member, for the simple reason you wouldn't, if both individuals were eligible for the program, it wouldn't make a lot of sense, in my view, to have, more than one case manager working in that household. The reimbursement, the cost for those services, I believe, would be probably much the same as they are now, where the federal portion in the state of Wisconsin is 60%, and then counties currently pay 40% of on every dollar for the services. But if in fact we would begin to provide services to non-tribal people, I believe that cost would be paid through, that 40% would be paid by the state. But presently we are not serving non-tribal persons.
Do we have any more questions? Again, press *6 to unmute your line, or feel free to type your question into the chat box. We have a few people typing additional questions into the chat box, so.
Hello, this is Ashley. I have a question.
Great, go ahead.
Yeah, Denise, I'm just wondering, and maybe I misheard you, but I believe you had stated you were working and hoping to expand some of the tribal capacity to provide long-term care services prior to the expansion of family care. What is the reasoning there? Or did
We've been administering our tribal waiver programs here since 2008. I believe the tribe was first approved. In 2010, we expanded our services out into the community because previously we were only utilizing the program for our residents of the community-based residential facility. So we've been administering a Medicaid waiver program, for 6 years already. in 2010, expanded that out into the community. And, you know, the need here is so great that, you know, I'm actually looking at hiring additional case managers to meet the need, meet the demand for services. Did I answer your question, or did I miss it? I'm sorry.
No, I guess you had just mentioned prior to the expansion of family care into that area, so that's, I guess, the part I wasn't understanding. And if that was to maybe capture some of the economic development potential, or just to have additional options for people to, you know, receive services, whether it's case management or otherwise.
Well, it's an added choice for our people, and tribal people are oftentimes reluctant to go to outside service providers. So this is an added choice. This is something that we want to continue to do. And certainly expanding our Medicaid waiver program in a county or in a reservation that's so economically depressed is huge for job creation. Almost every one of the individuals that we're serving has at minimum one supportive home care worker, so that's, you know, I'm hiring case managers here and individuals that's promoting job creation in our community. Certainly with, you know, when you're affecting the employment rate or unemployment rate, I think that we can anticipate it's also going to affect our economic base here. So there's a lot of benefits here to the tribe, to the community, and most importantly to our tribal members who, you know, generally are dying at such a young age. Our people literally were dying as they waited on the county's wait list.
Understandable.
And today they're being served.
Thank you.
All right, we have another question in the chat box, and that is, does supportive home care include both agency and individual providers?
Hi, this is Dennis. Can you repeat the question?
Sure. It says, does supportive home care include both agency and individual providers?
Yes, it could. We would contract with other outside agencies that we couldn't provide that service internally. So we would utilize other departments of the tribe, as Denise mentioned before, but we would definitely contract and utilize outside agencies to get those needs met. And then Denise also talked about creating jobs, and this is something for tribal people that they could actually create jobs, such as snow plowing, lawn care, that sort of thing, where we'd be able to contract, you know, with them independently too.
The other thing to remember about this is, you know, it's all about choice, client choice. And so oftentimes our tribal clients will have an individual in mind. And as long as those individuals are qualified to be supportive home care providers, usually the client will have a person of choice. But it can also include agencies.
Great. The next question is, how many employees are under the program, both full-time and half-time?
Okay, currently my staff would include myself. I have the long-term care coordinator. I have one tribal case manager. Presently, I am subcontracting for case management, and we have 5 individuals who have, you know, a varying level of a caseload. I'll soon have in place the ADRS individual who will, you know, help to serve in an outreach capacity. What I'm looking at doing here is increasing so in addition to myself, one case manager, one admin coordinator, and then the support staff, of course, our finance people, but positions that are here anyway. You know, I'm actually looking to increase our capacity by 4 to 5 case managers, you know, within the next probably 6 months' time. I want to have those individuals in place.
Do we have any more questions?
Those are all full-time positions, by the way.
Looks like we have one more question. And just as a reminder, to ask a question, you can either press *6 to unmute your line, or you can also type your question into the chat box. Sandy Bird is asking qualifications for case managers.
I'm going to give that question to Dennis because Dennis is a qualified case manager, and so he can tell you what his education has been. Dennis?
I am a certified social worker through the state of Wisconsin, so that involves, going through their requirements, which is having a bachelor's degree, and, basically it would be a state test, make sure you have the qualifications to take that test. You have to be functionally screen eligible to take the functional screen that Denise was talking about earlier to make sure our people are eligible. So, depending on the tribe, they might have different qualifications, what they're requiring. And Denise here really values education. So she's requiring somebody to have at least a bachelor's degree. But if you look on like family care and other things that are coming down, they're requiring a bachelor's degree, but not necessarily to be a certified social worker. And lots of times, go ahead.
I have a question to ask about the people that need that have serious health problems. Are you contracting with their doctors to come in to visit with them and take care of them, or do you have a doctor on hand at this facility?
We don't have a doctor on hand. The case manager will go in and sit down with the individual and develop the individual service plan for each of the clients. And basically they'll be, discussing with them what their needs are, what their preferences are. They'll sit down with the client, they'll sit down with the client's family and identify, who those service providers are. Many of our people utilize our tribal health facilities, so generally we'll have a doctor listed from our tribal health facility. If they require, specialty services, then those doctors are listed on the service plan as the provider of whatever that needed care is.
We definitely work closely with people's providers. We have releases to talk with them. And what we definitely don't want to do is go against medical advice. So we're in close contact with the physicians, nurse practitioners, nurses, and if they currently don't have a doctor, that's when we definitely would want to set them up to get that care. So we don't have a doctor on staff, but we work closely with whoever their provider is.
Thank you.
My question is a little different than the ones that have been asked. Can you list the benefits you've found so far with doing the 638 for long-term care?
Well, I guess I would go back to, many of the things that I've said here in the PowerPoint. But the biggest benefit is getting critically needed care to our people at an earlier age than they otherwise were getting it, particularly in our community where our people, have chronic conditions so young in their lives. And, I think the average life expectancy in Menominee County is actually under the age of 55. That's the biggest benefit to this program for our community, from my perspective, is getting the services to the people. In addition to that, we're able to stretch tribal dollars so that they can provide services to even more individuals. Certainly, the employment and the other things of significance that you see in the PowerPoint.
Thank you.
All right, we have another question in the chat box, which is, what training was involved in this process?
There's no handbook.
That's a difficult question to ask because maybe could the person be a little bit more specific? Training like for the tribe to develop this program, or training for our case managers? I need a little more information. What exactly they'd like answered?
Again, you can either type the question into the chat box, or it looks like person is.
As far as developing the program, if it's in regard to that, again, the State of Wisconsin Department of Health Services has been very, very helpful for us. They're totally committed to assisting the tribes to develop and build our long-term care programs in the state of Wisconsin. They actually assisted me by helping to provide a consultant for me to get started with this and to, kind of help lead me in the right direction as we were putting our program together. There really hasn't been any training per se, unless the training question relates to something else that I'm just not understanding the question.
And very quickly, I just wanted to follow up. One of the users was using the functionality of trying to raise their hand within the Adobe Connect system. And unfortunately, we are not utilizing that capability. So to ask a question or to ask your follow-up question, please press *6 to unmute your line and ask the question, or you can also type your question into the chat box. Thank you so much. In the meantime, we have another question, which is from Ashley, and she asks, what elements of the Menominee model of long-term care could be replicated by other tribes in the state or elsewhere?
Well, every tribe is unique, and I think each tribe would need to determine for themselves how they want to build their long-term care programs. But every element in the Menominee model could be utilized in every tribe in the state of Wisconsin that would want to do that. And I understand we currently do have at least one other tribe at this time that's preparing an application to the state of Wisconsin to become a tribal waiver agency themselves. It's hard for me to speak to other states other than the state of Wisconsin, but one thing that I do know is that one of the things I would encourage you to do would be to go to the CMS.gov and look at their roadmap for planning long-term care. I think it starts out with assessing your needs and this, determining what your goals and objectives are. The other important thing is to educate your states on, the whole possibilities for tribes to build long-term care programs in their own communities. But, as far as the elements of the Menominee model in the state of Wisconsin, every tribe, could do exactly what we're doing, or they could do whatever best fits their community as determined by their own tribal leadership and their own assessment of their needs.
This is Serena. We have one tribal long-term care facility in the state of Washington. We had another one, and they dropped that title because their people that were coming in did not want to pay what it costs to keep somebody in a long-term care facility. And I think I've been trying to talk to our people for quite a number of years about establishing one here on the close to the on the western side of Washington State, because the other one is across the mountains on the eastern side. And we've had people from our tribes on this side go to the eastern side to be in their facility. Now, I've been trying to remember how many people have gone in and out of facilities here, because I've been working here for a long time, and there's quite a few. But if I'd like to get a copy of how you set it up so that I could present it to my boss. Maybe she could present it to the council.
Well, a copy of the PowerPoint is available, or will be available. I guess if there would be any other questions or way that we could help here, I certainly would be happy to try to, give whatever information I can to anybody else. As I said, this has just been a wonderful program for the Menominee people, a much needed program. And going back to the concept paper that the state of Wisconsin is working with the tribes to develop, that will be submitted to the Center for Medicare and Medicaid for consideration or for federal authority. It's crucial. It's so critical to us that occurs. But again, I would go back and as I said, look at cms.gov, and they have a roadmap there to help you start planning for long-term care services. So I would encourage you to start there, perhaps. And it gives you kind of a step-by-step how to go about assessing your needs and determining what your goals are. And there's some other parts to it all, but I think that would be a good place for you to start.
I have one more question. A few years back, the unions came in and pushed really hard to have all of our caregivers join the SEIU. And unfortunately, a lot of the Native caregivers did not join, is what I've been finding out. Now, do you have a union that requires your people at your place to be unionized?
No, we do not.
Okay, thank you. Maybe we wouldn't have to either, and we could have natives working with natives. Thank you very much.
Most of our caregivers are family members, actually. As I said, it's usually by the client's choice and their preference. So the majority, if not all of our persons who are providing in-home care are generally family members or friends of the individual that they're caring for.
That's what's happening here too, but I'm talking about a facility. If a facility were to be opened,
oh, okay.
I was just wondering if we would have to deal with the union.
I wouldn't think on a reservation, but I'm no legal expert in that regard.
Okay, thank you.
The only facility we have is the community-based residential facility here on the reservation. And no, it's not unionized.
Okay, thank you.
Do we have any more questions? Okay, well, if you do have future questions, you can email them to ltssinfo@kaufmaninc.com. You can also view past LTSS webinars at the LTSS Technical Assistance Center on the cms.gov website. To access the TA Center, click on the outreach and education link, which is located on the cms.gov homepage, and then you can click on American Indian and Alaska Native link, and this will lead you to a page where you can access the TA Center. In closing, I would like to remind everyone that today's webinar was recorded and that the audio and PowerPoint will be made available online in the near future. Thank you again for joining today's CMS LTSS webinar, and this concludes today's session.
Thank you.
Can I just add one thing, Hannah? If anybody would want my contact information, I believe Meg or Cynthia at AOA have that information. And thank you.
And I can also provide, if you're okay with it, your email address in the chat box so that people will have it.
Sure, that's great.
Great. For those of you still on the line, I have just provided in the chat box the cms.gov Technical Assistance Center URL, as well as Denise's email address. And again, if you have any questions, you can email them to ltssinfo@kaufmaninc.com, and I will also include that email address in the chat box. And that concludes our webinar today. Thank you very much.